Sarah, a 35-year-old single mother who recently opened up about her challenges with anxiety and depression, is undergoing a comprehensive biopsychosocial evaluation with the help of a clinical social worker. Which source should the social worker prioritize as an important and reliable information resource for the purpose to acquire essential collateral data for a thorough assessment? A. Sarah's work colleagues. B. Sarah's extensive medical records. C. Sarah's closest circle of friends. D. A collection of Sarah's cherished childhood photos. B. Sarah's extensive medical records. In the context of a biopsychosocial assessment, accessing Sarah's extensive medical records is crucial for obtaining accurate and comprehensive information regarding her physical and mental health history. Medical records may contain valuable insights into past diagnoses, treatments, medications, and relevant medical history, all of which contribute significantly to the assessment process. While input from work colleagues, option A, friends, option C, and personal childhood photos, option D, can provide some context, they are unlikely to offer the level of detail and reliability found in comprehensive medical records. A social worker is conducting a comprehensive mental status examination, MSE, with a client who has been referred for assessment due to recent changes in behavior and cognitive functioning. The client presents with disheveled clothing, aggressive body language, and appears disoriented during the assessment. Which specific aspect of the MSE primarily focuses on the client's appearance, behavior, and level of alertness? A. Affect and mood. B. Thought process. C. Sensorium and cognitive functioning. D. Speech and language. C. Sensorium and cognitive functioning. In a comprehensive mental status examination, MSE, the aspect that primarily focuses on the client's appearance, behavior, and level of alertness is sensorium and cognitive functioning. This part of the assessment evaluates the client's orientation to time, place, and person, as well as their general appearance, behavior, and level of alertness. The client's disheveled clothing, aggressive body language, and disorientation are indicators assessed under this category. A social worker is working with a client who is a military veteran and has recently returned from a deployment in a combat zone. The client presents with symptoms such as flashbacks, nightmares, hypervigilance, and avoidance of reminders of the traumatic event. What assessment method should the social worker use to effectively assess the client's trauma-related symptoms for a mental health disorder? A. The Beck Depression Inventory, BDI-2. B. The Mini Mental State Examination, MMSE. C. The PTSD Checklist for DSM-5, PCL-5. D. The Substance Abuse Subtle Screening Inventory, SASI. C. The PTSD Checklist for DSM-5, PCL-5. In this scenario, the client's presentation strongly suggests symptoms of post-traumatic stress disorder, PTSD, which is a specific trauma-related condition. The PCL-5, PTSD Checklist for DSM-5, is a validated and widely used assessment tool specifically designed to assess trauma-related symptoms and diagnose PTSD. It is essential in cases where trauma exposure is suspected, such as in military veterans returning from combat deployments. The other assessment tools listed are not designed for the specific purpose of assessing trauma-related symptoms and PTSD. Rebecca, a 40-year-old woman, is seeing a social worker because she has been experiencing physical symptoms, including frequent headaches and gastrointestinal distress. Despite undergoing medical examinations, no apparent medical cause is found for her physical symptoms. What term is used to describe the conversion of psychological distress into physical symptoms, which may be evident in Rebecca's case? A. Somatization. B. Feigning illness. C. Malingering. D. Somatic symptom disorder. A. Somatization. Somatization refers to the process in which psychological distress is expressed and converted into physical symptoms, even when there is no underlying medical cause. Rebecca's presentation aligns with somatization, as her physical complaints have no apparent medical explanation. This term is essential in understanding her condition. Feigning illness, option B, implies intentional deception, while malingering, option C, refers to consciously pretending to be ill for secondary gain. Somatic symptom disorder, option D, involves excessive and distressing thoughts, feelings, and behaviors related to somatic symptoms, which may not necessarily involve the conversion of psychological distress into physical symptoms as seen in somatization. A social worker is working with a client, Mark, who has been struggling with a severe substance use disorder. During their session, Mark expresses a strong preference for a harm reduction approach to address his addiction. What is a key principle of harm reduction that the social worker should consider when developing Mark's intervention plan? A. Abstinence is the only acceptable goal for treatment. B. Gradual reduction of substance use is encouraged to minimize harm. C. Clients should be immediately discharged from treatment if they relapse. D. Coerced treatment is the most effective approach for all clients with addiction. D. Gradual reduction of substance use is encouraged to minimize harm. Harm reduction acknowledges that not all clients are ready for complete abstinence and focuses on reducing the harmful consequences of substance use. Encouraging gradual reduction can be a more realistic and achievable goal for some clients, as it helps minimize the risks associated with substance use. This approach prioritizes client safety and well-being. A social worker is working with Leon, a client who has been diagnosed with schizophrenia and has been prescribed antipsychotic medication. Leon expresses reluctance to take the medication due to concerns about potential side effects, including weight gain and drowsiness. What steps should the social worker use to effectively address Leon's concerns? A. Persuade Leon to comply with the medication regimen. B. Respect Leon's autonomy and discuss the potential side effects and alternatives. C. Administer the medication without Leon's consent. D. Ignore Leon's concerns and focus on other treatment modalities. B. Respect Leon's autonomy and discuss the potential side effects and alternatives. In this situation, respecting Leon's autonomy and engaging in a collaborative discussion about the potential side effects and alternative treatment options is the ethical and client-centered approach. It acknowledges Leon's concerns and empowers him to make informed decisions about his treatment. Coercion, option A, or administering medication without consent, option C, is not appropriate. Ignoring the client's concerns, option D, would not promote trust and collaboration in the therapeutic relationship. A social worker is conducting a comprehensive assessment with a client who is facing severe financial difficulties and is at risk of losing their home. During the assessment, the social worker explores the client's social support network, problem-solving abilities, and resilience in the face of adversity. What critical aspect of assessment is the social worker demonstrating through this process? A. Evaluating client strengths and resources. B. Identifying indicators of abuse. C. Assessing psychosocial stressors. D. Conducting a mental status examination. A. Evaluating client strengths and resources. In this scenario, the social worker is engaged in assessing the client's strengths and resources, such as their support network, problem-solving skills, and resilience. This aspect of assessment is crucial for developing a holistic understanding of the client's situation and creating an effective intervention plan. It focuses on identifying the positive attributes and abilities that can aid the client in overcoming challenges, which is a fundamental part of social work practice. A social worker is conducting an assessment with a client, Jane, who has recently experienced the sudden loss of her spouse and is struggling with overwhelming grief. During the assessment, Jane mentions feeling a deep sense of guilt and anger, particularly related to unresolved conflicts with her late spouse. What type of grief is Jane most likely experiencing? A. Anticipatory grief. B. Complicated grief. C. Disenfranchised grief. D. Normal grief. B. Complicated grief. Jane's experience of intense emotions, including guilt and anger, which are connected to unresolved conflicts, is indicative of complicated grief. Complicated grief often involves prolonged and complex emotional responses to loss, making it challenging for the individual to adapt to the loss and move forward with the grieving process. It may require specialized intervention and support to address these complicated emotions and facilitate the grieving process. A social worker is working with a client, Alex, who has been diagnosed with borderline personality disorder, BPD. Alex presents with self-destructive behaviors and intense mood swings, which have significantly impacted their daily life. What therapeutic approach is most likely to be effective in addressing the complex and challenging symptoms associated with BPD in this case? A. Cognitive behavioral therapy, CBT. B. Psychodynamic therapy. C. Solution-focused therapy. D. Dialectical behavior therapy, DBT. D. Dialectical behavior therapy, DBT. Dialectical behavior therapy, DBT, is considered the most effective therapeutic approach for individuals diagnosed with borderline personality disorder, BPD. DBT specifically targets emotional dysregulation, self-destructive behaviors, and intense mood swings, providing clients with valuable skills to cope with these challenges. It emphasizes mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness, making it a well-suited approach for clients like Alex who present with these symptoms. While other therapeutic approaches may have some benefits, DBT has shown consistent effectiveness in addressing the core features of BPD. A social worker is working with a 32-year-old client named Emily who has a history of childhood trauma and struggles with trust issues. Emily finds it extremely challenging to form meaningful relationships and often experiences intense anxiety in social situations. What therapeutic approach may be most beneficial for Emily to address her trust and relationship issues? A. Psychodynamic theory. B. Behavioral theory. C. Cognitive theory. D. Psychosexual development theory. B. Behavioral theory. Emily's history of childhood trauma and her difficulty forming meaningful relationships suggest the need for a therapeutic approach that focuses on observable behaviors and provides practical strategies for trust building and improving social interactions. Behavioral theory emphasizes changing maladaptive behaviors through techniques such as reinforcement, modeling, and social skills training, making it a suitable choice for addressing Emily's specific challenges. While other therapeutic approaches may have their merits, behavioral theory's practical and skill-building focus aligns well with Emily's needs. I trust this video has proven to be informative in enhancing your comprehension of social work license exam questions. If you're interested in expanding your studies, I assure you a captivating and enlightening 90-minute study session where we'll analyze questions and explore real-world applications. Come and join me for an amazing learning experience. Enroll today and gain access to an amazing chance to receive my exclusive ebook with 70 social work practice questions or my comprehensive online practice exam with 150 social work questions. And that's not all. As a bonus, you will also receive my highly sought-after Strategies for Success activity ebook at no cost. This amazing bundle is crafted to empower you on your learning journey and guarantee your ongoing success. Don't pass up on this opportunity. Enroll today. Visit my website, gilbertmbell.com, and find the sign-up link in the description below. Alternatively, you could text the word study to 347-683-7923. I am excited to study alongside you and assist you in reaching your full potential as a social worker. Thank you once more for tuning in.